Hello, good morning. This is Dr. Karthik Gunasekharan from the Metromale clinic, urologist, andrologist, and sexologist. There have been a lot of requests for people asking me to speak in my mother tongue, which is Tamil. And well, I don't want to speak in Tamil on this channel because this is a purely English channel. But I am speaking a lot on Vendar TV, and there is also a new show called Thayangama Kelunga Boss, which is aired on Vendar TV every Sunday at 10:30 p.m. So all the Tamil viewers, if you feel that I need to speak in the vernacular, please log on to Vendar TV on Sunday at 10:30, and you will be able to watch this fantastic show. For the first time, we're doing this show with a female compeer, and a lot of very interesting questions and interesting topics that are being discussed about. Now, the topic that I want to talk about today is about sterilization. Well, I actually don't like the word sterilization, but I would call it, fertility prevention program. Now, in women, we do something known as tubal ligation, which is basically tying up the tubes. Now, you know that it may be a very, very simple procedure, but we do have to use of a laparoscope. And when I talk about a laparoscope, we need to make punctures. We make punctures inside the abdomen, fill the abdomen with gas, then use clips to tie up the tubes. So this is basically tubal ligation. Though it is a daycare procedure, it still involves general anesthesia, and there is a risk, and there is a little bit of extra pain, and the recovery period is slightly prolonged, right? So, but the most simpler aspect of male fertility prevention or sterilization, as they call it, would be to do a vasectomy. Now, a lot of people don't know about what a vasectomy is. The vas is predominantly the tube that carries sperm from the testis to the external apparatus, which is basically the urinary tube. So, if you do ligate or cut the vas in the middle, now that will prevent the sperms from going through, and it's a very, very effective program of male fertility prevention, or rather sterilization. So the vasectomy is a very underrated procedure in our country, but let me tell you, it's a very, very, very simple procedure. It can be done even under local anesthesia with mild sedation. Now, we at our clinic adopt this technique known as a no-scalpel vasectomy, where we don't even use a blade. With just the help of an artery forceps, we are able to pick up the vas and then divide the vas and ligate the ends. The small portion of the vas is sent for biopsy. So this, how it is better than the female sterilization, is that the pain is very, very less. The recovery is absolutely non-existent because the patient just walks home in a couple of hours. So I would totally recommend a vasectomy procedure for couples who are looking for fertility prevention, but at the same time somebody who's looking at a very, very minimally invasive technique wherein the female partner is also going to work. You don't want to subject her to a week of a holiday and all that. So I want to try and encourage vasectomy for you guys. So if you are planning at contraception, a permanent contraception technique, please look at the vasectomy in men, and don't keep pushing your women to go ahead and get a sterilization done. So thanks for watching, and if you do like our videos, please subscribe to us. And like I said, don't forget to watch our Tamil episodes on Vendar TV, Thayangama Kelunga Boss, every Sunday night at 10:30 p.m.